Okay, good morning everyone. We're going to get started. Just a brief overview of the next 30 minutes. We will have 4 speakers this morning whose names and titles are all included in your media materials. Our final presenter, Charlene McBrien-Morrison, will be providing a demonstration of the website. You'll notice we also have some computers set up at the side of the room. These are so that you can navigate the website yourselves. You can choose to use them at any time or wait until the formal part of our news conference concludes. We have the computers available because the website is not optimized for a mobile device. You'll see that its features are best displayed on the larger screen of a desktop or a laptop computer. Just a reminder that once we conclude the formal portion of the Q&A, we will have Dr. Holroyd available for questions. And I will take questions from reporters in the room, and we do have an audio line where I will take questions. I would like to now introduce Ms. Irene Pfeiffer, Vice Chair of the HQCA Board of Directors, who will be providing opening remarks.
Good morning, everyone, and thank you for coming. On behalf of the Health Quality Council of Alberta's Board of Directors, I want to thank you for joining us today. We're here to present you with a new and exciting tool and a website developed by the Health Quality Council. The Health Quality Council is mandated to monitor Alberta's healthcare system and to report to Albertans, and this new tool fulfills that mandate in a very unique way. Today, the HQCA will share their new tool and website for reporting information about what Albertans experience in our healthcare system, starting with the emergency department. This work was developed in collaboration with the Alberta Health Services and others, and on behalf of the HQCA board, I'd like to thank these organizations for their support and interest in helping the HQCA conduct its work. It's now my pleasure to turn this presentation over to Dr. Brian Holroyd. Dr. Holroyd.
Thank you, Irene. Over my career in emergency medicine, a primary goal has been excellence in the care we provide to our patients. And as I'm sure you're aware, this isn't always a straightforward task. That speaks to the reason I wanted to be here today at the launch of HQCA's interactive online reporting tool, Focus on Emergency Department. This approach to reporting brings a heightened level of transparency to the emergency care we deliver to Albertans in the 16 busiest emergency departments in the province. This site includes data that is credible, understandable, and relevant. The information will be regularly updated in a timely manner. I'm very excited to have been invited with my colleagues to play a part in informing the development of this amazing, innovative tool. The website is already starting conversations. Our team has had a chance to have a sneak peek at it. We're finding areas of care in the emergency department that we do really well. We want to celebrate those. We're also finding areas where we can improve and areas where we can learn from another emergency department to improve the care we provide. The incorporation of actual patient experience metrics in this online tool is a very key component of the program and supports our need to understand those factors that contribute to making the best experience possible for patients when they are in our emergency departments. I look forward to this online tool being made available by HQCA to Albertans today. Thank you very much. Thanks.
Thank you, Brian. The Health Quality Council of Alberta, through our legislation, is mandated to measure, monitor, and assess health service quality in Alberta. Our legislation also requires us to report our findings to Albertans. We really believe in the power of information. Transparency with Albertans is critical as it fosters trust and confidence in our publicly funded healthcare system. And that's why we're here today. We're extremely excited to be launching a new online interactive tool for health system reporting in Alberta, starting with a focus on emergency departments. This new HQCA website reports healthcare innovation or information in an innovative and unique way that is not available anywhere else in Canada. This new website is a single source of truth for Albertans. It includes patient experience data, is accessible to all audiences, puts the data and measures into the context of quality in the overall healthcare system, will be updated every quarter, is interactive in nature, and provides narrative context. This website will also be a powerful tool in helping with system efforts to improve the system. Evidence indicates that when quality measures are publicly reported, the results of the measures actually improve over time. Providers and administrators can use information to identify areas of success and opportunities for improvement. Conversations are initiated and solutions developed. FOCUS stands for Fostering Open Conversations that Unleash Solutions. Through this website, Albertans, emergency department providers, healthcare administrators, and patients alike can look at 18 measures and learn more about each of the 16 busiest emergency departments in Alberta over a 5-year period and compare findings to similar types of emergency departments in the province. The information on the website tells a narrative about how all the measures relate to each other in the larger healthcare system. The measures are presented in the most objective way possible. We do not analyze or interpret the results beyond ensuring audiences understand the information presented. I'd like to point out to you that as you look at the different measures on the website, it's important not to look at any of the 18 measures in isolation. An emergency department could show consistently poorer results than a comparable emergency department on one measure, yet in another measure consistently exceed other sites. For example, longer wait times to see an emergency doctor does not always mean patients' overall care experience is below average. If patients report that staff always introduce themselves, it often results in higher overall patient-reported care experience. Charlene will show you an example of this in the demonstration. Emergency departments are the first area of the health system the HQCA will be reporting on, but this website will be expanding. Our Focus on ED website is the beginning of a broader initiative that will see us report information in the same way in other areas of the healthcare system, like primary healthcare or continuing care. The HQCA chose emergency care first because the emergency department is often seen as the canary in the coal mine and can be a barometer for what's happening in the broader healthcare system. What's happening in the hospital or even continuing care can impact patients' experiences in the emergency department. In developing this website, we used the Institute for Healthcare Improvement's Triple Aim framework to guide us. The Triple Aim is an internationally recognized approach to optimizing health system performance. It has 3 components: patient experience, outcomes, and cost. At this point, the HQCA's survey and Alberta Health Services administrative data comprise the patient experience element of the Triple Aim framework. The 18 measures on the website come from 2 types of information: results of an HQCA patient experience survey conducted with people who have recently visited an emergency department, and emergency department and hospital data provided by Alberta Health Services. Access to reliable and accurate costing data in the ED has posed challenges that the HQCA is seeking to resolve. In addition to the Triple Aim framework, a logic model was used to guide our thinking and to determine the best measures to report. The logic model looks at the patient's journey into, through, and out of the emergency department. It shows how the larger healthcare system impacts the care the patients receive in the emergency department. We also know from our survey work that the things that patients undergo and experience throughout this journey impacts how they feel about their overall experience. This slide lists the 7 emergency patient experience survey measures that are available on the website. The HQCA does a telephone survey every 2 weeks with samples of patients from each of the 16 emergency departments. We use a survey tool that is tested and widely used in North America, and our results are reliable, representative of the emergency population, and accurate. This slide lists the 11 administrative measures that are available on the website. Alberta Health Services provides the HQCA with the data for all these measures. As you can see, these include things like wait time to see an emergency doctor to hospital occupancy. We will include some measures from the hospital because, as I said earlier, what's happening in the hospital or even continuing care can impact patients' experiences in the emergency department. These are the 16 emergency departments who are included in the reporting. The HQCA reports the sites within peer groupings so that like hospitals are fairly compared. You will see this in the demo shortly. It didn't make sense for the emergency department at the University of Alberta, for example, to be compared to the emergency department in Medicine Hat or to the Children's Hospital in Calgary. Our process and approach to this project was collaborative. Over the last 18 months, the HQCA engaged with emergency department stakeholders from Alberta Health, Alberta Health Services, Covenant Health, Alberta Medical Association, academia, and patients to determine which measures would be most helpful from a quality improvement perspective. Focus groups with patients and also with frontline providers helped to identify which measures would be appropriate and useful for public reporting. We want to thank everybody who was part of the work of this project. Unlike any resource available in Canada, this innovative tool offers user-tested, comprehensive, easy-to-use, interactive charts supported by a descriptive narrative to help start conversations about the information being presented. On behalf of the HQCA, I'm extremely excited to be sharing it with you today. Albertans can trust that when they need to go to any emergency department in Alberta, they will get the care that they need. What this tool offers is the ability for all users to identify trends at the emergency departments where they live or work. They can look for differences between sites and over time. This information can start conversations and lead to solutions for improved quality of care. Charlene will now provide you with a demonstration.
Great. Thank you, Andrew, and good morning, everyone. I'll be taking you through the features of our online healthcare interactive monitoring tool. And we're going to start here on the home page, and then we'll go and look at some of the specific measures. So beginning right at the top, we start with a frequently asked questions document, just for people to go to quickly. Acknowledgements, again, Andrew's mentioned the partners that we worked with and the many stakeholders that contributed to the initiative, and a data dictionary. For the more technically minded users who want to know more about the data sources and how the measures are calculated. Moving down the left side is a link to a leave feedback screen where users can let us know what else they might like to see and how they think we can improve this tool. Scrolling down a bit more, on the left side is a link to the Alberta Health Services website for users that want to know current or real-time emergency department wait times. The measures that we're showing on our interactive tool are based on historical trending information. In the diagram, you can see that we're showing that the emergency department is part of the larger health system, specifically hospitals and continuing care, which interact with and impact the patient's journey through and out of the emergency department. So you can see we show patients moving into the emergency department, through, and then out of the emergency department. The icons that you see displayed here represent the 18 measures. If you hover over an icon, the window opens up with the name of the measure, and if you click on the measure here, it will take you directly to the specific chart. There are 3 types of icons that represent the different types of measures. If we scroll down to the bottom, the measures are listed here under each of those categories. The clock represents time measures, the 2 arrows represent process measures, and the word cloud represents patient experience measures, and these come from the Health Quality Council of Alberta's Patient Experience Survey. You can also get to the specific chart here simply by clicking on the name of the measure. Now we'll go to some of the specific measures, and we're going to start with patient time to see an emergency doctor. So you can see here at the top of the page for this chart that a brief description sits right under the name. And this is time from when a patient arrives in the emergency department to when they first see a doctor for assessment. Again, on the left side, you can see the leave feedback icon, and this is the same for every measure. Staying on the left side, you can see the many ways that a user can choose to view the data. You can choose the hospital type, and I'm going to go to medium urban. You can choose the urgency or acuity of the patient that's being seen in the emergency department, the time period for how you want the data displayed, and the type of metric, 90th percentile or median in this case. Beside each of these categories, you'll see a little I button. and that enables you to see a brief description of that category. It'll pop up and describe each of those hospitals, for instance, in this example. The need for that information button came from the usability testing that we did with patients and healthcare providers that said they just needed a little more information about what all these categories meant. Okay. So beside each, sorry, I already went through that. If we move to the far right side of the graph, what do you see? These are some questions that we've provided to the users so they can be a little more informed, and it helps them understand what the data means, some of the questions they can ask themselves as they're viewing the data. And for some of the measures, down below here, where relevant, we've provided a link to patient volumes, which shows a chart of the average number of patients that are visiting that specific emergency department per day. At the bottom of the screen, again, further detail to help the user understand what it is that they're looking at. And we provide links to other measures within this text that are related to the measure that you're looking at on screen. So now, if we look at this particular measure, we've chosen medium urban hospitals, CTAS 3 or urgency of 3, quarterly data, and the 90th percentile. You can see hours on the left-hand side and the time frame along the bottom. And the better arrow shows that less hours is a better result. This arrow also came from our usability testing in that it helped the users in interpreting the information correctly. You can see that each trend line represents a different emergency department, and the colors on the line match the legend on the left side. If I hover over a specific data point, depending on the type of metric chosen, which in this case is the 90th percentile, it explains very clearly what that data point is representing. So if we look at a specific emergency department, in this case, it's the Sturgeon Community Hospital in St. Albert, just by clicking on the line, I can bring forward that line to see it more clearly, and the other trend lines fade into the background. And if you click it again, the lines reappear. So we can see here that the Sturgeon Community Hospital has, over the past 5 years, had longer wait times to see an emergency doctor than the other emergency departments in their peer group. However, as Andrew mentioned earlier, it's important that we don't look at one measure in isolation. So now I'm going to take you to a patient experience measure for Sturgeon Community Hospital. We've gone back to the home page, and now I'm going to choose overall patient experience with emergency department communication. Again, a brief explanation of the measure sits under the title, and so we're looking at that overall experience communicating with emergency doctors and nurses. The time period for reporting survey measures, just so you know, starts in April of 2016. So again, on the left side is our leave feedback button, and we're going to choose medium urban doctors, and we're going to look at monthly data. So again, if I choose the Sturgeon Community Hospital, you can see that how their patients rate communication with doctors, it sits at or better than their peers at approximately 90 out of a score of 100. And now we're going to go to one more patient experience measure. And this is the overall rating of care. So again, we can choose medium urban and monthly, and we'll choose Sturgeon again. And from here, you can see that Sturgeon Community Hospital trend line. We can see that their patients rate their overall care at or better than their peers at a score of 80 out of 100. We've learned from our patient experience surveys that despite longer wait times, in this case, time to see an emergency doctor, this does not necessarily impact the overall rating of care when communication is really good between the staff and the patients waiting. And Sturgeon Community Hospital really demonstrates this, that even though their patients experienced a longer wait time than their peers, the overall experience for patients was still quite high and rated very well. So again, this demonstrates how important it is to look at all the measures, not any one in isolation, to get a more complete understanding of the patient's experience in any of the emergency departments. The last measure I'm going to take you to is where we've applied a nationally recognized benchmark, And this is length of patient hospital stay compared to the Canadian average. And this Canadian average length of hospital stay comes from the Canadian Institute for Health Information. If again we choose medium urban, just to be consistent here, there we go. We can see that the hospitals in the northern part of the province, and this is Sturgeon Community Hospital, the QE2 in Grand Prairie, and Northern Lights Regional Hospital in Fort McMurray, they show a shorter hospital length of stay than the Canadian average compared to those hospitals, Red Deer and South, including the Medicine Hat and Chinook Regional Hospitals, which showed a longer length of stay, again, compared to that Canadian average. And you can see from the arrow here that below that line is better. This completes the demonstration. Last thing I just want to take you to, back to the home page. If anyone wants to learn more about the HQCA, who we are and what we do, take you to the bottom, and there's a link directly to our webpage. So thank you, and I'll turn it back to Andrew.
Thank you, Charlene. Before we open the floor for questions, I'd like to again offer my thanks on behalf of the HQCA to the many people who helped with this project. Alberta Health Services for the data they have provided, and the many other stakeholders and patients who provided input, participated in usability testing, and will help us to share this tool with Albertans. Thanks also to the reporters who are here today and on the phone and will help us inform Albertans about this new tool. Thank you.